co-director of the USC Schaeffer Center for Health Policy and Economics. We are a research center housed at USC, jointly based in the School of Public Policy and the School of Pharmacy. And we have the kind of underpinnings of important, rigorous academic research, but our real mission is beyond that, and that's to have impact and do research that's valuable and both grounded in asking real-world questions, but also focusing on dissemination and engagement with the public sector as well as the private sector. And we really see that as key partners and stakeholders in making sure that we ask questions that matter and that then we engage with a broad audience to make sure that our ideas are getting out there and implemented well. So we were very enthusiastic and excited to plan and now have this conference with Andrew and the London Business School. We saw this as an excellent opportunity to learn from the kind of global experience and the lessons that have come out of the COVID-19 pandemic, to think about what that means both from the infrastructure of our healthcare system, but also the way that we think about value and innovation and kind of driving change, and what we need to do to encourage that, and how do we want to keep the good things that we learned from COVID and perhaps get rid of some of the things that didn't work, and really start to engage in that conversation in a very rigorous way. We've learned throughout the last couple of years is that we had, particularly in the US, a sort of kind of unprecedented interaction between the public and private sectors, and really opening new doors for true engagement and role for the private sector to step in. We have a long-standing history of great, fantastic innovation coming out of the private sector, but I think some of the things that we learned here were the regulatory changes that needed to happen to facilitate innovation moving more quickly, and really, the advent of a vaccine with it for, against this global pandemic, against COVID-19 in about a year's time is really quite remarkable. And it showcased both the power and the incredible kind of intellectual wheelhouse or the intellectual capacity that existed there in the biomedical sciences to be able to pivot that and apply it toward this new pandemic, this new virus, was quite remarkable. But that took a lot of innovation and a lot of dedication from the private sector to make that happen. And it took engagement with the public sector to try to facilitate those processes and open up new regulatory pathways. And I think the goal here is to think about, it was very acute in all of our lives, this pandemic, this virus, but we are afflicted by chronic disease and by many other conditions. And what we're trying to do now is build on the lessons learned to figure out how we can accelerate the innovation and the dissemination of what we know and the therapeutics that exist and that need to exist in the future to target many more diseases. My background is actually as a biomedical engineer, and I spent my first couple years out of college, out of university, working in a stem cell biology lab that was focused on translating therapies to deliver new cures and new research for patients. What I realized in that time there, I spent many long nights, late nights pipetting, and it's fantastic science and truly inspiring. But what I kind of learned as I watched in my young 20s, that much of what was going to matter about getting therapies into the hands of patients was much more affected by the policies and the incentives at play, and how do we encourage the innovation and the translation, and it takes a lot more than brilliant scientists to actually get something into the hands of a patient that needs it. And that's where I think the role of economics and policy has a lot to add in terms of creating the ecosystem to inspire innovation, and then think about how we finance it and how we make a sustainable healthcare system built on that type of innovation, so that we can truly improve lives for patients. And that's what we, the social sciences and the policymakers and the analysts, have to offer to make sure that we're getting the most out of the biomedical sciences that are doing their part to create these therapies too. Yeah, so less so on a particular disease category, but right now there's a lot of policy debate and discussion kind of more generally about pharmaceutical pricing, particularly in the US. This has been a hot topic of policy discussion. Actually, one example is insulin. One of the biggest conditions, diabetes is one of the biggest conditions that affects those in the US and globally. And, there's a huge debate about, how much we should pay for drugs, how much we should pay. Some of my colleagues at the Schaeffer Center recently wrote an excellent paper that actually said, broke down and recognized the majority of dollars that we spend on insulin in the US today don't even go to the drug manufacturers, but go to all the middlemen in the supply chain. And we're trying to shed some light on these issues, and this is a real problem for patients and being able to afford their insulin at the pharmacy counter. But the issue is that we need pharmaceutical manufacturers to have the incentive to create innovative drugs. In this particular case, they're not even the ones who are getting the returns anymore from, that these are going to others who are not providing the same type of innovation. So it's an example that shows that there's a lot of complexity in unpacking what's going on in this industry, and that we really need, well-designed, rigorous policies to encourage the type of innovation that we want and make sure that we're driving returns to those who are providing innovation and not others who are kind of capturing the excesses that are created by the distribution market that's not working very well today. So, I think we'll stay in business for a long time because it's such a complicated industry to understand and to let alone be able to communicate to others about what's truly going on. If you come to, some of our presentations, you can see charts with tons of boxes and arrows and everyone's, how can it be so complicated just to get this pill into my mouth? But turns out that it is. One of the things that another study that we recently did, so it was looking at Costco, which is a big, kind of large-scale a warehouse store. You can go and buy, giant cases of toilet paper and paper towels. Turns out that you can also buy generic drugs at Costco pharmacies. And in that market, you just go and pay cash. You're a Costco member, you go pay cash directly, just the same way as if you're buying your cat food or your paper towels. And it turns out that we showed that in that type of environment, the prices of common generic drugs were considerably cheaper than typically what insurers were paying when they were buying them on behalf, when insured customers were buying them through this complicated supply chain. And so, I think that's everyone in the US knows what Costco is. They know about, the bulk purchasing. They know about the free samples. They know about all of how well this market functions to drive products at value. And so when we can provide poignant examples or salient examples like that, where when that same type of principle is applied to the common generic drug market, we're also able to get better value, that starts to help, enlighten folks to kind of what are the issues with the current market as we know it. Now, how we solve that is another step, another layer of complication in the explanation, but at least we can understand, that there is an option of a better functioning market out there. I think just as you described, there's a number of complexities and differences, but there's a lot that really grounds us and is central to all of our countries. And I think, we all want the pursuit of better health and wellness and longevity. And that kind of across these 4 days, this conference is really about harnessing the global pharmaceutical innovation, but also thinking about as society ages and shifts, what do we expect? What do we need from our healthcare system? This and society writ large, I think that this global pandemic has given us an opportunity to kind of appreciate the true incredibleness of what healthcare has to offer. But it's also given us the opportunity to reflect on, what will be the evolving needs of our society nationally and internationally moving forward. And how can we kind of leverage the lessons that we've learned to ensure that we're thinking about that now and, to be prepared ahead of time for not only the next pandemic, but for treating all of the chronic disease and aging and other conditions that will be affecting society all across the world.